Hello and welcome to the TUSD Required Bloodborne Pathogen Annual Refresher Training. The following slides will give you a brief overview of the specific federal requirements to help protect you against worksite occupational exposures to bloodborne pathogens. The Occupational Safety and Health Administration, or OSHA, has set up a federal workplace standard on how employees should protect themselves while at their worksite. The Federal Workplace Standard can be looked up on your computer by Googling 29 CFR 1910.1030. A copy of the TUSD Exposure Control Plan for Bloodborne Pathogens is available at each TUSD site on any work computer. On the TUSD Risk Management intranet site, a bloodborne pathogen is a microorganism that can be transmitted through blood-to-blood contact like an open wound or cut. Contact can also be bodily surfaces like eyes, your mouth, or mucous membrane areas. Exposure to a bloodborne pathogen can cause the following: human immunodeficiency virus, HIV, which can lead to AIDS, hepatitis C, HCV, hepatitis B, HBV, malaria, or sexually transmitted diseases. HIV can be caused by different types of blood-to-blood contact. HIV can be transmitted through bodily fluids such as blood, semen, vaginal fluid, breast milk, and other fluids containing blood. Federal laws protect those infected. They are not required to tell their employer or coworkers that they are HIV positive. Parents are not required to tell schools that a child is HIV positive. Hepatitis C is also a bloodborne pathogen that is caused by blood-to-blood contact. There is no vaccine for this virus. Some potential complications of hepatitis C can include liver disease and liver cancer. Hepatitis B is also caused by blood-to-blood contact. It can be transmitted through different means. It can be transmitted through mucous membranes. If a bodily fluid were splashed into your eyes, it could transmit hepatitis B. Hepatitis B may have as long as a 6-month incubation period. 20 to 30% of those exposed to hepatitis B will develop the disease. Approximately 50% of those who develop the hepatitis B virus will not be symptomatic of the disease. 10% of those infected will be lifelong carriers who will always be contagious. The symptoms of hepatitis B are flu-like and may include fatigue, abdominal pain, appetite loss, nausea, vomiting, and dark urine. One important thing to note is that hepatitis B is a preventable disease. TUSD provides at no cost to you hepatitis B vaccine shots. The vaccine is a series of 3 shots. It is voluntary but highly recommended because it gives you the benefit of knowing you are protected against the hepatitis B virus. While exposure to a bloodborne pathogen at TUSD is minimal, there are some job classifications that are considered at a higher risk than others. If you are a school nurse, nurse practitioner, practical nurse, health assistant, athletic trainer, coach, dental hygienist, campus monitor, plumber, bus driver or bus monitor, substitute teacher, building engineer, audiologist, occupational therapist or physical therapist, speech clinician or aide, an exceptional education teacher or exceptional education teacher aide, infant care specialist, or individuals certified in CPR as a condition for their employment, or if you are a school safety or field safety person, you should get the hepatitis B vaccine. The schedule for hepatitis B shots is online on the TUSD Risk Management intranet site, or email Risk Management, or call Risk Management at 225-6601. Exposure to a bloodborne pathogen at TUSD is minimal, but can be reduced even further by wearing protective gloves and following standard exposure control practices. A standard exposure control practice is done by periodic hand washing. The hands should be wet. Put some dispensable soap on them, and then wash vigorously for about 30 seconds, then rinse off, and dry with paper towel. This should be done before eating, drinking, or feeding. Also before handling food or kitchen utensils, and after toileting or assisting in toileting or diapering students. The hand washing should also be done after any contact with bodily fluids, drainage from wounds, mucous membranes, or objects contaminated with bodily fluids after the protective gloves are removed. Protective gloves or disposable gloves are the most common form of personal protective equipment or PPE. Wear gloves when giving first aid, cleaning bodily fluids, handling contaminated clothes, objects and waste containers. Wear protective gloves or disposable gloves when feeding, toileting, diapering students, or hand and mouth speech therapy. Use disposable gloves only once. Discard without touching the outside of the glove with your bare hands. Discard the gloves into a proper waste container. Masks, aprons, goggles, glasses, and face shields are other examples of personal protective equipment or PPE. While everyone should practice bloodborne pathogen procedures like wearing protective gloves and following standard exposure control practices of periodic hand washing, it is possible an accident of some sort could still happen. If an accident happens in your area or classroom and bodily fluids are spilled, call a custodial staff member to clean it up. You should not be cleaning bodily fluids yourself. Custodial staff have been trained, have the equipment, and use the approved disinfectants to clean bodily fluids. After the bodily fluids spill has been cleaned, it is normally then put in a trash bag. The trash bag should then be put in another trash bag, so the contaminated waste materials are double bagged. The nurse's office or the custodial staff will normally be doing the double bagging of contaminated waste materials. After the bodily fluids spill has been cleaned, as just stated, it should be put in a trash bag. The trash bag should then be put in another trash bag, so the contaminated waste materials are double bagged. The nurse's office or the custodial staff will normally be doing the double bagging of contaminated waste materials. Ensure the contaminated waste materials that were double bagged are contaminated waste. There are several types of waste. We will cover regulated waste and contaminated waste. Simply speaking, a regulated waste is a waste that is saturated or dripping with bodily fluids and is controlled by special disposal rules. A contaminated waste is a waste that is not saturated with bodily fluids and is not controlled by special disposal rules and can be disposed of in the regular garbage. After a spill has been cleaned, you must add paper towels, newspapers, or other paper matter to soak up the bodily fluids to ensure it is contaminated waste. After cleanup, be sure to remove all PPE without touching the contaminated area. When you remove your disposable protective gloves, grasp the outside of one of the gloves near the wrist. Pull and peel the glove away from the hand. The glove should now be turned inside out, with the contaminated side now on the inside. Hold the removed glove in the opposite gloved hand. Then slide one or two fingers of the ungloved hand under the wrist of the remaining glove. Peel the glove off from the inside, creating a bag for both gloves. Discard the disposable gloves in a trash bag and then add paper towels, newspapers, or other paper matter to soak up any bodily fluids to ensure it is contaminated waste. The waste materials should then be put in another trash bag, so the contaminated waste materials are double bagged. Then follow up with standard exposure control practices of thoroughly washing your hands or any body parts that were exposed to contamination. If you have been exposed to bodily fluids from a bite, treat it as potentially infectious, and the area should be antiseptically cleaned, bandaged, and reported to workers' compensation. The risk of transmission of bodily fluids during a sporting event is low, but if a bodily fluid accident happens and bleeding occurs, play should be stopped and the wound must be properly cleaned and bandaged using universal precautions. A universal precaution is considering that everyone's bodily fluids are contaminated. Therefore, you would protect yourself from all bodily fluids at all times. The person could also be given an absorbent material to apply pressure to the wound until help is available. Blood or bodily fluids should be cleaned up before play is resumed. If you think you have been exposed to bodily fluids, on-the-job exposure of bodily fluids should be reported to your supervisor or site administrator and to the workers' compensation office by the end of the workday. You, with your supervisor's assistance, will need to submit a report of significant work exposure to bodily fluids or other infectious materials to the workers' compensation office no later than 10 days after your exposure. This form can be found on the workers' compensation website, or risk management website. Following the report of significant work exposure to bodily fluids, or other infectious materials to the workers' compensation office, the workers' comp office shall make immediately available to the exposed employee a confidential medical evaluation, and all follow-up evaluations. The Workers' Comp Office shall also follow up with other bodily fluid instances like prophylaxis, a mouth disease or condition which involves bleeding, or other evaluations of reported illnesses. Here are some additional suggestions that may help you protect your skin from bodily fluids. Exceptional education staff and monitors should consider wearing long-sleeve garments which can give some protection from scratches, abrasions, and bites from students. Coaching staff and monitors should consider having moisture-resistant windbreakers or jackets available to wear if needing to attend to an injury or bodily fluid exposure. Coaching, athletic staff, or transportation staff who transport exceptional education students should consider having a supply of a district-approved disinfectant to disinfect equipment if contaminated from a bodily fluid exposure. As previously stated at the beginning of this presentation, this was a brief overview of the specific federal requirements to help protect you against worksite occupational exposures to bloodborne pathogens. To recap this presentation, we have covered the following items, to include: a copy of the regulatory text of this bloodborne pathogen standard can be looked up on your computer by Googling 29 CFR 1910.1030. We also covered a general explanation of the epidemiology and symptoms of bloodborne diseases, an explanation of the modes of transmission of bloodborne pathogens, the employer's exposure control plan, activities that may involve exposure to blood and other potentially infectious materials, an explanation of the methods that will prevent or reduce exposures including standard practices, universal practices, and personal protective equipment. Also information on the types, proper use, removal, handling, decontamination and disposal of personal protective equipment. Regulated waste versus contaminated waste. Double bagging of contaminated waste materials. Information on the hepatitis B vaccine, including information on the benefits of being vaccinated, and that the vaccine and vaccination will be offered free of charge. What to do in an emergency involving blood or other potentially infectious materials. An explanation of the procedure to follow if an exposure incident occurs, including the method of reporting the incident and medical follow-up. And an opportunity for questions and answers about the training session you have just viewed. Here is our contact information. Please call if you have any further questions or if you want more information on the previous subjects. Please call the Risk Management Department at 225-6601. Thank you.